One of the most common complaints addressed in chiropractic clinics is sciatica. The number of phone calls and medical histories that include the patient informing me of the diagnosis sciatica is something in the range of 45 to even 50%. With this very frequent complaint, what exactly causes it and how is it best addressed? After watching this video, if you have sciatica, you should be able to figure out exactly what the cause of it very well may be. Or at the very least, at least have an idea of the correct direction to head in to solve it. Firstly, we need to know the difference between a symptom and a diagnosis. Sciatica is a symptom. It is pain down the back of the leg in the sciatic nerve's distribution. The sciatic nerve is the largest nerve in our body, and it travels out the front of our sacrum, or the bottom of our spine, and down the back of our leg. Someone saying they have the diagnosis of sciatica to describe their leg pain is the same as somebody with arm pain going to a healthcare clinic and the doctor giving them a diagnosis of arm pain. Not particularly useful and completely redundant. And this kind of highlights the difference between a symptom and a diagnosis. A symptom describes the patient presentation. These are things like pains on certain movements or activities. A diagnosis is the healthcare practitioner's attempts to describe the root cause of the symptoms. For example, a person may have the symptoms of runny nose, sore throat, and fever, and the diagnosis could be the cold or influenza or COVID. But it is not a fever, sore throat, or runny nose, right? So then when someone has the symptom of sciatica, what's the diagnosis? There are three common explanations to why someone may be experiencing sciatica, and then a fourth, less common, a little bit more serious. And then in addition to that fourth, there's also a bunch that are significantly more dangerous, but also significantly more rare. Let's start with the common and benign ones. Anecdotally, one of the most common causes that I see patients for sciatica with is something called SI syndrome. As already said, the sciatic nerve exits out the front of the sacrum and then runs down the back of the leg. This is in very, very close proximity to the SI joint, or the sacroiliac joint, because it connects the sacrum and the ilium. The SI joints are some of the most immobile joints in our body, however, they do still move. A healthy SI joint usually has between 2 to 3 degrees of rotation available to it. These degrees of rotation are necessary in order to avoid tension along the sciatic nerve with movement. Loss of this movement equals tension on the nerve equals experience sciatic pain. 2 to 3 degrees again really doesn't sound like a lot, but let's use a bit of an analogy here. Our shoulders on average have 180 degrees of abduction, also known as lifting it up towards our head. I hope you could hear that. I moved away from the mic. If we lost 2 or 3 degrees of shoulder abduction, who cares? We still have 98% function. However, if we lost 90 degrees of abduction, we would only be able to get our shoulder up halfway and lost 50% of function. Suddenly, everybody cares. Now apply this line of thinking to the SI joint. If we were to lose even 1.5 degrees of rotation, we've lost 50% of function. That's a problem. The next possibility is Facet syndrome. Facets is the term given to the joints that connect our vertebrae to each other. They're also referred to as Zygopophyseal joints, but facet's a lot easier to say. The sciatic nerve is a bundle of lumbar nerves which include the L5 and the S1 nerve. These nerves are given this name because they just exit the spine at the level of the 5th lumbar and the 1st sacral vertebrae. I already made a video on the effects of facet joint inflammation and the impacts on nearby spinal nerves, and you can watch it up here. In a quick summary, resultant inflammation around a facet joint may also affect the nearby nerves, which in the case of sciatic nerve, if that inflammation is in the right, or depending on how you look at it, wrong location, you may experience sciatica. Number 3 most common that I see is piriformis syndrome. The piriformis is a very important muscle located deep to our gluteal muscles. In the large portion of the population, the sciatic nerve passes directly underneath. There is some rare anatomical variability where the sciatic nerve may pass over top or actually go right through, but in the majority of the population, it passes under. Hypertonicity, or being very, very tight, may cause direct impingement on the sciatic nerve by the piriformis. This pinching, as you've probably guessed by now, can cause sciatica. The piriformis functions primarily as a hip external rotator, or turning your foot and hip outward away from you. It's predisposed to tightening up in people with weak gluteal muscles or who do not engage their glutes necessarily when they should be. Therefore, the best solution to this, in addition to just active release therapy, would be strengthening your glute muscles. And with that, we are brought to disc herniations. Disc herniations are one of those diagnoses that everybody worries very frequently about, but are actually quite rare compared to the other causes. I swear a good chunk of treatment for a lot of my patients is just reassuring them that their discs are actually completely fine benign and uninvolved in their complaint. In short, our discs exist between our vertebrae, and given enough stress, they may herniate backwards directly into our spinal nerves. The mechanical pressure by the herniation on the spinal nerve may act in a very similar way as the hypertonic or tense piriformis muscle may, causing sciatica. Those are the three most common sources of sciatica that I see in my clinic, plus one fourth that isn't particularly common but seems to be at the forefront of a lot of people's minds. In addition to these four diagnoses, there are also other explanations that could be responsible. Some other more serious differential diagnoses for sciatica include lateral stenosis, which is narrowing of the intervertebral foramen, or the hole for which the spinal nerves exit the spinal canal from; cauda equina syndrome, which is a central disc herniation when the discs herniate directly back into the spinal cord, not the spinal nerve roots; spondylolisthesis, which is both a real word and describes a fracture of the pars interarticularis, or where our vertebrae are connected to each other; spinal canal infections, which result in an abscess and pressure on the nerve roots; or even pelvic tumors. Once again, this is a very complete list of differentials, and those at the end are very, very rare. So if you are one of the people experiencing sciatica, what should you be doing? The very first thing, and it would be kind of obvious if you watch my other videos, is to consult with a healthcare provider for which you trust. If that healthcare provider gives you the diagnosis of sciatica, ask them to explain what is causing it, and if they can't, or if you're unsatisfied with the answer, I highly recommend seeking a different healthcare provider. In the meantime, a self-screening method that you can use is to simply move. Move your lower back and body through a wide range of motions to see if it either provokes or lessens your pain. Don't push through pain if it does provoke it, just see if it does make it worse in the moment. If your pain and dysfunction levels differ depending on the position you are in, it's very likely that you have a musculoskeletal or a mechanical component to your problem. And if you have a mechanical problem, well, evidence-based chiros, we are musculoskeletal experts. There's the self-plug. If your sciatica persists between all positions and movements, it's very likely you have a more visceral complaint than you do musculoskeletal, and in that case, you should go see your MD or general practitioner promptly. You should probably go do it promptly. Thank you so much for watching, guys. I really do appreciate it. Please subscribe down below. I broke 50 subscribers, which is not a lot, but to me, that's a pretty big landmark, so let's get to 100 next. You can click here for the previous video, and you can click here for the most recent one. Have yourselves fantastic days.